Well, it's a pleasure to be here on this very interesting panel. So I will be spending the next few minutes speaking about the health co-benefits of urban climate action. Mostly, this is about mitigation or actions to reduce our greenhouse gas emissions, but I'll also touch on adaptation as well. As I'm sure many of you appreciate very well, cities are really central to realizing the health co-benefits of climate action. This is for several reasons. Cities are responsible for much of our energy use and greenhouse gas emissions. They concentrate populations, assets, infrastructure, but also in many cases, the health risks of climate hazards like urban heat island. But they're also a very important scale for implementation of climate policies. For example, in Europe, we have a European mission which has the aim to really stimulate 100 climate neutral cities by 2030. Urban environments are also very important for supporting energy efficiency and pro-environmental behaviors. In this figure, you can see a sort of rank ordering of actions individuals can take to reduce their individual carbon footprint. And you'll see many of these actions, like going car-free or adopting a plant-based diet or shifting from a fossil fuel-based vehicle to an electric vehicle, are much easier in urban environments because of access to services, for example, and the sort of infrastructure to support these low carbon behavior changes. So when we look at the available literature on the health co-benefits of climate change mitigation, it's really quite a small subset of that literature that has focused at the urban scale. You can see that in this recent scoping review, most of that literature that is really focusing in on the urban scale has looked at transport, a little bit around energy efficiency, quite few studies have looked at greening, for example, but we're really talking about less than 10 studies that were included in this review that were looking at health co-benefits in urban related to urban scale mitigation. But we know that there are many things that cities can do to reduce greenhouse gas emissions that have potentially important impacts on health. So for example, when we look at transport, there are sort of city-level policies and plans like adopting 15-minute cities, compact urban design, reducing travel demand through teleworking or services, or really trying to promote active and public transportation that can have important impacts on health through things like reducing air and noise pollution, reducing road traffic injury, and impacting active travel-related physical activity. I should say it's not always a health benefit. There are increasingly studies that are looking at the impacts of things like 15-minute cities, which in cases where that means less travel, it also can mean less active travel in places that have very high levels of active travel mode shares. So we need to be mindful of these potential, say, negative unintended consequences of some of these actions. In terms of buildings, cities have an important role in setting performance standards that can influence, basically reduce greenhouse gas emissions related to electricity and heating and cooling, but also influence indoor air pollution levels and thermal comfort. They can also promote food environments that increase availability of low carbon healthy food, so promote benefiting health through sort of healthier dietary composition and more optimal caloric intake. So let's say there's a literature, there's an evidence base around the health co-benefits of climate change mitigation at the urban scale. I would say it's not big, there are many, let's say, gaps. But what I see as some of the sort of most important gaps are really the issue that we have most of our evidence really coming from modeling studies. And we have very few examples of evaluation of actually implemented mitigation actions and what those mean for health. So there's a very important, let's say, knowledge gap there around really understanding what happens in the implementation of these actions and basically monitoring and evaluation of them. We also have some very important data gaps. I think one of the first ones is really around having a good idea of the greenhouse gas emissions at the city scale. We do have some emissions inventories that have been downscaled to the urban scale, but they typically capture only the sort of in-territory emissions or the scope 1 emissions, when what we want is a much more complete picture that reflects the consumption and that occurs in cities and the sort of embedded greenhouse gas emissions associated with that. Much of our work in Europe around active travel, what we see is that we really have a limitation in terms of having consistent, harmonized data on transport mode share across cities, which is another important data gap. Another challenge I think we have is that as many of these mitigation actions are being rolled out, we see essentially backlash. So this has happened for things like low traffic neighborhoods in the UK. It's happened with the super EAs in Barcelona. There are many other examples where we see these sort of structural and cultural barriers to some of what we see as the most promising mitigation actions. So I think there's a very important challenge there to understand how the evidence we generated and the sort of communication around that can be used to overcome those barriers. So going forward, I think there's a very important sort of need to be much more specific about these change pathways. When we, how do we basically implement these mitigation actions? Who needs to do what? Who benefits? Who pays in terms of the costs of mitigation? Very important is, I think, having a much better idea of the distributional impacts of the health co-benefits of mitigation actions across population subgroups. This, I think, is essential information, particularly when we want to address some of those sort of issues of backlash, which many of them sort of stem from these equity considerations. So having approaches like agent-based modeling, which I see as a really powerful tool to provide this kind of information, will be very important going forward. And I think more generally, we need to be smarter about how evidence gets used in the policy process. And I think there's a really important role of working with people in political science and communication to understand how this evidence is getting used and how to target it much more effectively to basically support more ambitious mitigation action. So I just want to very briefly touch on sort of the interactions between mitigation and adaptation and their links to health. There's a possibility of having a sort of a co-benefit where we have a mitigation action that also has an ancillary benefit for adaptation and health, but we also have trade-offs where a mitigation action can be disadvantageous for adaptation. And I'll just very quickly give some examples. So this is an example of a co-benefit. So there's quite a lot of interest in basically urban greening or urban trees, specifically for providing, basically reducing temperatures in cities. This is one example where you can see quite sizable temperature reduction at the local scale from urban trees relative to the sort of built-up urban fabric. And we know that these nature-based solutions can also be very important from a mitigation point of view. So it's estimated that about 17% of total greenhouse gas emissions can be reduced through nature-based solutions through reduced energy demand, basically, for cooling. But also, there's some additional greenhouse gas emission reduction through carbon sequestration and storage from that, let's say, urban green infrastructure. But we also can have trade-offs. So urban compactness is very appealing for mitigation, very important for reducing emissions from buildings and transport. but also can be problematic from an adaptation point of view. Highly dense urban areas with limited green space can be really increase urban heat island and the associated energy demand associated with that, and also increase vulnerability to flooding. So we need much more sort of integrated approaches that are looking at both the mitigation goals, the adaptation goals together, and their links to health. So this is my final slide, just to highlight some of the work we're doing in the Lancet Countdown European Regional Center. Our normal indicator reports are focused at the national scale, but we have a special report focused at the urban scale that will come out next year, and will include indicators that cover the sort of usual domains of Lancet Countdown reports, which is sort of summarized in this figure here. I don't have time to go through them, but we're very excited about this report because of the very obvious importance of the urban scale for climate change and health. And this gives us the opportunity to bring in some new indicators for issues specifically important at the urban scale, like active travel, urban heat island, that don't really, are not sufficiently covered when we are sort of constrained to looking at the national level. And I will stop there and leave you with these websites here if you are interested in learning more about what we're doing on health co-benefits in the Catalyze project or the Lancet Countdown.